Incontinence and other complaints of a weak pelvic floor are common for many people who have a chronic lung condition, such as COPD. In this section, we're going to discuss some tips for healthy bladder and bowel function. The bladder is made up of muscle. It's like a balloon, and as it stretches, this sends signals to our brain to tell us that it's time to empty the bladder. The bladder only has one job, and that is to store urine. Our bladders can hold between 400 and 600 ml of urine, which is a couple of glasses or the equivalence of a pump bottle. The bladder can store urine for 3 to 6 hours. Therefore, we should be able to go this length of time without needing to visit the bathroom. It's important we keep our bodies well hydrated, and this is particularly important for people living with a breathing condition. The ideal amount of fluids is about 4 to 5 glasses per day, and there are a few signs if you're not drinking enough. Look to make sure your urine is a pale yellow in colour or even clear. If it's darker than this, then you may not have had enough to drink. Good fluid intake also helps to ensure our bowel motions are soft. Sometimes our bladder can get twitchy and result in us needing to visit the bathroom frequently and with some urgency. Some of the things that affect the bladder can be alcohol, fizzy drinks, too much coffee and tea, or even a bladder infection. Water is the best fluid to be drinking, and is especially important if you're experiencing some bladder concerns. It's okay to have some tea and coffee, but try to limit these to only a few a day. If you find that you're experiencing symptoms of frequent and urgent visits to the bathroom, it can be worth trying to retrain your bladder. This involves teaching your bladder to hold for longer, aiming to get to 3 hours between passing urine. If you find this challenging, your GP would be able to refer you to a physiotherapist for more assistance. Our pelvic floor muscles are like a sling that passes from the pubic bone at the front to the tailbone or sacrum at the back. The pelvic floor holds up the bladder and the bowel. There are many factors throughout our lives that can have an effect on our pelvic floor, and this can be for both men and women. Some of the factors include childbirth, age or hormonal changes, coughing, breathlessness, extra body weight, surgery, heavy lifting, or even constipation and straining on the toilet. Strengthening your pelvic floor can be a helpful way of improving control of your bladder and your bowel. Here are some exercises that can be completed at any time. You want to sit upright in a chair and imagine you're sitting on the toilet emptying your bladder. Try to lift and squeeze the muscles around your front passage as if you were to stop the urine flow. If you can't feel it in the front, try and bend more forward, making sure to keep your back straight. Try and hold the muscle up for 2 to 3 seconds, gradually building up to 5 seconds. If you cannot feel it, relax and try holding for less. Make sure you don't hold your breath, and make sure your bottom, thigh and stomach muscles are relaxed. If you cannot hold for 3 seconds, it's a good idea to practice. Aim for 3 seconds, about 5 to 10 times, until the muscles feel shaky and tired. Do this exercise little and often, and aim to do the exercises multiple times a day. These are some tips to help you to remember to do your pelvic floor exercises. Find a time that works for you and make it part of your daily routine. This might be after you've finished on the toilet, when you're at the traffic lights, when you're making a cup of tea, or even during the ad breaks. Think of a trigger that might help you to remember. To protect the pelvic floor from weakening further, contract the pelvic floor before doing activities that require effort. For example, coughing, sneezing, exercising, and lifting. This is called the knack. The knack is a way of using your pelvic floor muscles to prevent leaking during activity. To perform the knack, lift and squeeze your pelvic floor muscles and try to hold them when you cough. You can do the knack when you cough, sneeze, lift, etc. Normal bowel habits can vary from 3 times a day to once every 3 days. It is not necessary to go every day, and you should not have to strain to empty the bowels. Constipation causes weakening of the pelvic floor muscles and is defined as passing a bowel motion less than every 3 days and straining to empty the bowels. To avoid constipation, make sure you're eating plenty of fruit and vegetables. Also ensure that you are having about 4 to 5 glasses of fluids per day. Also, regular exercise can help. If you're experiencing symptoms with your bladder and bowels and need more assistance, please speak with your GP. Ngā mihi nui.